just to restart. So this is neural-based consciousness week 6, and this week I'm going to talk about the neural correlates of consciousness. Let's go through the recap of week 5 quickly. We learned that anatomically, cone receptors that are responsible for the color vision reduces rapidly of the phobia. However, we experience color in the periphery through the demonstration, and we wanted to know how this, physiological and also phenomenological facts can be reconciled. Some people, some theorists and philosophers think that we should doubt about phenomenology rather than physiology, but we provided several evidence to suggest that not necessary. So first of the move that we made was a phenomenological investigation. So to cope with a possible explanation based on the eye movements, the memory, and the expectation to explain this peripheral color experience, we can devise an experiment where we present a colored patch in the periphery, very brief duration, and also at an unexpected location. And then we still found that the color experience is pretty much the same as the foveal locations. And then first, after confirming that phenomenological facts, we also found that learned that the neurons at the far area, far eccentricity, tend to have a bigger receptive fields. And I explained the concept of the receptive field last week, and that's very important. And then I also explained that the convergence across the hierarchy, like from the retina to LGN, LGN to B1, B1 to B2, B2, B3, B4, B5, IT, and so on. As you go across the higher areas of the visual hierarchy, receptive field tends to become larger by many, because many small receptive field neuron converge to one neuron from the hierarchy below. And based on this physiological consideration, we arrived this conclusion that uniformly colored surface should elicit a vivid color experience even at the periphery, because peripheral neuron that has a bigger receptive field size should be stimulated by particular color if there is a uniform colored surface like here, and then that should combine to result in a very clear color experience. And it was the case according to the demonstration. But at the same time, if not magnified at the periphery, like this very small dot at the periphery cannot be seen. And that's because the particular neurons in the periphery collect input from other locations, and then this small tiny dot will be dwarfed by the background and so on, and it becomes noisy. So we also learned the important concepts of features of neurons in the visual system, receptive field and visual hierarchy, as I explained, and because has the receptive field at the periphery, as well as the higher areas of the brain, and the columnar organization and the layer structure within the area, and the multiple visual pathways. So visual pathway exists in parallel at the same time, and then each of them has a different kind of functions, which I don't explain too much in detail right now. And then we also with this we also explained the dissociation of what's on the display versus what we experience actually. And does anybody remember the name of the illusion that I showed last week on this thing? What we see is what's not there. It's probably a bit difficult. Any idea? No? It's called a lilac chaser. Lilac. I'll just type. Lilac chaser. And if you look at the slide in last week, then you should be able to find it. And then as one component of that illusion, I explained that after image is responsible. And then the question became that where this experience of the after image is coming from. And if you look at the Wikipedia, then it basically says that after images are coming from the retina and the retinal adaptation. However, with introduction of continuous flash suppression, it turns out that if you suppress the adapter, color adapter from the consciousness by doing, presenting some flickering and also a strong contrast pattern at the other eye, which should not, interfere with the after image generation in the other eye, then resulting after image became much weaker. And that's the evidence, counter evidence for retinal adaptation explanation. And I already explained it in the last week. So if it wasn't clear, just ask me right now, or I'll just go on. Okay. And then after that, I also explained that there is an fMRI experimental evidence to suggest that after images are potentially generated in the area V4B8. And the V4B8 is likely to be involved in color experience in general. So the after image I'm talking about here is about the color after images. And the other evidence includes the lesion patients who had a lesion in the V4B8, lost color experience in that particular corresponding area, as well as electrical stimulation. I showed the video of the patient who reported spontaneously rainbow color or colorful things are happening in the visual field. And somehow the moving stimuli this is Sucho. And then Sucho and Alvarez found that moving stimuli suppressed our ability to see changes in color. Sucho and Alvarez. So that's the sort of the display that I introduced towards the end of the last week, where this color dots changing its color started to stop changing when the entire display moved like this way. And so it's called motion silencing by Sucho and Alvarez. And I started to introduce this, color experience is quite different from motion experience, which is kind of obvious, but there is some interesting interaction between them. So this week, we will start with the neural correlates of the visual motion in the beginning. So with that, is there any question about the week 2 lecture content so far? No, the week 5 lecture content so far? If not, sorry. Okay, so then let's go on for this week. So the learning objective for this week is to be able to answer the question of where are our quality of visual motion coming from, and what's the causal relationship between the neurons in MTV5 and the conscious perception of visual motion, and what are the neural correlates of consciousness in general as a sort of a concept. And then what are the empirical experimental designs and strategies to find the NCCs? And then finally, can we manipulate consciousness while keeping other psychological processes, such as attention, the same? And reading material-wise, where quality are coming from, chapter 4, and Quest for Consciousness 5 to 8. All right, and then before getting into the content of the lecture, I just wanted to give some evidence-based tips on the how to sort of effectively prepare for your e-assessment in week 7. So this is a book I strongly recommend. It's called The Range. And in general, this book suggests that you shouldn't really specialize to small things, but generalize to learn many things to better perform in the world in the job scene in the future. And the reason why I put this link to the range is that not only this one, but many other, active learning kind of studies across over the last 10, 20, 30 years has been showing that the most effective way to learn things is to have three components. One is the spacing and the interleaving and then testing. So what it means is that the spacing means you shouldn't actually learn one thing in a focal duration of, let's say, 1 week or something, and then just forget about that. So if you are trying to learn all the lectures for e-assessment just before that test period by watching the lecture video all the time just before then, it's going against this spacing rule. And then interleaving means that when you learn things on one topic, it's better to intermix with different kind of topics. So I kind of intentionally do that within this class, not to talk about only phenomenology or philosophy or AI or neuroscience or psychology, but I try to intermix. And that's actually known to be better in the long-term learning and the long-term outcome of the learning. So even within this class, I strongly recommend that you do you watch the lecture or you attend to this lecture and then do something else and then come back. That's much better than doing one thing all the time. And then testing means that you use the material as a question and then test it by yourself. And without testing, it doesn't actually leave the longer term memory, or the skills do not improve. So several concrete tips are that try to answer all the questioning learning objectives in each week. So I try to construct these learning objectives always as a sort of the question mark. And so if you write down your own answers when you're reviewing each week, just by writing your own answers without really trying to remember the contents of the things before try to write down, you probably can't write down all the answers, but you probably also make a mistake, and that's totally fine, because it turns out that as you make more mistake during the practice, the eventual performance at the real test improves. So try to do as much as possible, but don't worry too much about when you are making mistake. Sometimes people are worried that if you make a mistake in the beginning, it may be difficult to change your mind later, but that's not going to happen in this kind of learning situation. And then also another thing to suggest is that for those people who are attending to this lecture right now or watching this at the normal speed, I also suggest that at the time of the reviewing, watch the videos at the twice or three times faster. And then that will make probably part of the lecture difficult to understand. And that part is, in a sense, kind of what works as a testing. You try to fill in, you try to interpret that, or you try to actively reconstruct a theory. And then after that, if you are not really sure, then just come back with a lecture slide or slower speed. And that's also known to work really well in terms of active learning. And then also doing this 2 days after, or 2 weeks, maybe 2 weeks is too long until the end of the class, but the 2 days, 2 weeks, 2 months is a good interval to make this kind of spacing or interleaving kind of move for your active learning. And then finally, it's very difficult to do in practice, but it's known to be extremely effective, which also contains all these spacing, interleaving, and testing, is that to pretend or try to give a lecture on the material that you're not super sure. And that will ensure that not only this class, but the other classes, you'll probably do really well in terms of the test score, as well as utilizing this knowledge you gained from this class to be generalized across different life circumstances. Is there any question about this? Okay, otherwise then let's move on. So the first part of the lecture is about this question: where are our quality of visual motion coming from, and what are the causal relationship between neurons in MTV5 and the conscious perception of visual motion? So this is the view from the back. You see, this is the eye, and then this is the input to the eye. And then you are kind of looking at the brain from the back of the brain. And then this part is the back of the brain in the middle. And to the left and to the right, there is a visual cortex, ARE visual cortex B1, B2, B3, B3A, and the B4. And this is the one that's, B4 and B4, B8 is the one that is likely to be relevant for color. And then the cerebellum is the one that we talked in week 2, that we may not need it any for conscious experience. And then this part, a little bit to the side and also a little bit to the up superior location, there is this relatively tiny area of the brain called the MT or B5. It's very tiny compared to the rest of the brain, but it's very critical for our visual motion experience. So the phenomenological reports of bilateral MT patient, when you lose both of the MT at the same time, then the clinical phenomenon of akinetopsia arise, akinetopsia here. And if you look at the Quest for Consciousness's glossary, then it says that a specific deficit in the perception of visual motion due to a cortical lesion in and around area MT. Okay, and if you are interested, I recommend you to follow this link and then watch the video of this akinetopsia. So here. And this one is this one is a movie made by some student in, I think, Israel, and then they kind of constructed a fictitious case report interview by the doctor, and also a patient's phenomenology depiction. So here is the relatively famous kind of a depiction of the akinetopsia. If you pour the water or tea in this case to the cup, then you lose the sensation of motion, and it looks like strobotic. So you have lots of trouble with seeing the when to stop the cup feeding. And this one is also phenomenology of the patients who are looking at inside the house when people are walking around, and it's described sometimes that the people just come in and out, and also stopping motion randomly. It's very, very uncomfortable, and it's very difficult to navigate in the family or situation. And crossing the road is also very, very difficult, as you can imagine that the car comes in and go in this way. So that's the sort of the akinetopsia phenomenology. So motion perception also seems to go down if you lesion carefully this V5 or MT area within the monkey. And that's not something that I'll cover here. And as the case of the color, after effects are also very useful to locate where this motion quality is coming from. The idea is that to fatigue the neurons or the mechanism responsible for the motion, and then to generate this weird sensation of a motion effect specifically, but not any other location, and then look at the neural coordinates related to that motion perception. Here's motion after effects. So I hope this one works. So if you look at the central cross without moving your eyes, and also don't blink, just stare at that for a moment. What happened to you? Maybe once or twice doesn't work, but if you do it a couple of more seconds, it will start to work. Just stay at the center and then don't move your eyes. Don't blink as much as possible. And then when you start to see this, a statue of the Buddha, what happens? Can you type your experience in your chat box? Aura, yeah, that's but what kind of aura? That's the question. Just pay attention to how this face looks like. So this one is actually static statue. It doesn't move. Yep, yeah, so the statue looks like it's moving, but in fact, as a sort of figure, it doesn't move. But moving in what way? Does somebody tell what kind of movement do you experience? I'm not seeing any movement. Okay. So maybe if that's the case, then you might need to download, go to this website by yourself, and then try to do it on your end, because Zoom may not be optimum for your frame rate and things like that. So one possible thing is that, okay, yeah, so Ju is saying that the statue looks like moving forward. That's probably something that you experience. Moving forward or expanding from the center, right? That's probably what you're experiencing. So the motion you're adapting is contracting to the center. And then contraction neurons are supposedly fatigued. And then after that, expansion is sort of balancing out, and then you experience that. And because it's centered around Buddha, Buddha start to feel like expanding. Does it make sense? I hope this works. Yeah, okay. So if it doesn't, just to make sure that you get this effect and what it means to have this motion after effect. Okay. So for the purpose of the class, it's also important to take a look at the neural correlates of consciousness, neural correlates of the motion after effect. So here's the idea, very similar to what we discussed last week about color after image. Here, the first experimental situation is to show the stimulus in a expansion, and then after seeing expansion for a really long time, then stimulus, stationary stimulus starts to look like contracting, okay? And that's what you experienced, I hopefully, or the other way around. And then this is the fMRI image, and this is an inflated version of the cortex, so that it's easy to see this embedded area in the brain. So what's happening here is that if you contrast the activity between moving versus stationary, then this is the area that shows the biggest difference, and that's the area empty. Okay, so here's the activity difference. You see that during the expansion, the activity of this area increases from 0 to 3%, and then when it became static, it goes down. And then expansion or contraction. So this is an expansion and contraction going back and forth. That doesn't generate motion after effect. Still generate a lot of activity, and then static, it goes down. And then now concentric motion, which is exactly the same as you saw. After that, you see static, and then go down. And then expansion and contraction alternating, and then static. And if you do that this way, then like last week's color after image experiment, the clever way to subtract is to see the contrast between single direction condition, which is this expansion or contraction, which induces motion after effect afterwards, minus reversing the direction situation, which is this expansion contraction, which does not induce any motion after effect. And then if you compare across the area, that period where you're supposed to experience the motion after effect here and here, minus this period. So you basically take this and then this and the average, and then subtract this and then this. And then you'll see this time course of the response. So up to here, this is during the motion period, which looks almost the same as here, 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 here. And then subtract the stationary period where people are either experiencing motion after effect or not. And then that's observed within MT. So that's the nice demonstration of correlation of the motion qualia and the activity in the MT. Make sense? Any questions so far? Fine? Okay. All right, now it's 25 minutes, so I'll take a break here and then we'll come back in 4 minutes.